I'm going to bring us back into order at this time. We are now at Town Council Roundtable. I'm going to pass it to Town Manager Page to facilitate the first part of this discussion.
Can you hear me okay? I tried to stay out of the bubble. Thank you. Sort of a two-part conversation to talk with Council about tonight. The first is vaccine incentives. The second are mask mandates. Last week on Wednesday, Wake County notified all of the Wake County managers that they would be issuing a release on a vaccine incentive policy, shared that information, and then we had a manager's call on Thursday to talk through that. Short story is all the municipalities in Wake County, I think, are supportive of, if they did not already have something in place, putting in some incentives to increase vaccination rates for employees. I will tell you, we're all over the place in the types of incentives, the amounts of the incentives, who's involved in the incentives, COVID testing, and how that might occur, putting programs in place. Some key takeaways that I will provide to you as we talk about how Morrisville might want to consider this is the municipalities that attempted to incite vaccination through just offering leave were not really very successful. They did not find that just leave was enough of an incentive for people either to get vaccinated or, interestingly, to provide a vaccine card if they had been vaccinated. As the incentives became monetary, that has increased some participation. As we know, rates of infection and vaccination rates are different across the county, so I think that does influence what some people are doing. We did get generalized data from Dr. Mashunga to share in our manager's call that was subsequently shared with mayors, and it was substantially the same presentation that was provided at the Wake County Board of Commissioners meeting on Monday, primarily related to mask mandates that we'll come to. So we've gathered a whole bunch of information, and staff had a meeting yesterday to just sort of talk through what would be involved for Morrisville to offer that. I think some key points that I was in particular trying to determine is what would be a right amount. Again, they're small, $250, which is Wake County and some other municipalities, up to Cary is talking $1,000. Knightdale offered $1,000 gross, which means the cost to the town is about $1,600 per employee. So those are some factors as we talk to them about what is driving people's decisions. It is I think making it worthwhile while managing it within potential budget considerations. There has been talk about whether ARPA money may be used for this. I'll say the jury is out. The federal guidance indicates there has to be increased vaccine success. If you don't have baselines, that's more difficult to approve. The School of Government has indicated they did not think it was legitimate expense for ARPA, more to be evaluated. And Wake County is sort of leading the effort at trying to get more information on that. But if we wanted to provide something, I think that our safest way would be to say this is going to be coming out of our general fund. And then if we could use ARPA money, that would be gravy. We do not and have not asked our employees if they are vaccinated. We have empirical information that we think there's been a relatively high rate of vaccine, but that is just what we think. It is not what we know. And just for some round numbers, we have 200 FTE slots. Let's say there's 200 full-time employees in our workforce. And then we have about 100, we sort of did a quick check and have asked, in particular, our Parks and Rec program, not only, but a lot of use of part-time workers who are also providing services. And a big part of my discussion is part-time workers versus full-time workers. But incentives being provided to part-time workers. And then the discussion has centered on whether it's the same amount of the incentive versus some pro rata portion. And there's arguments that could be made on both sides of that. I mentioned Cary. It is a benchmark for us because they're so close to us. Our employees and everyone, including ourselves here, often compare ourselves to Cary. There is some provisions and some guidance that incentives can't be coercive, and that's not defined. So is $1,000 too much, or is it not too much? The $500 rate does appear to be a prominent one, and then some are offering options with some leave. Again, I don't think leave is enough of an incentive for us here in Morrisville. We're pretty good about giving our employees leave, so I just don't think it's an added incentive. And again, I have lots of information I can share that I'm not going to bog down this conversation, but we've run some generic scenarios. When I initially talked with the mayor about this on Friday, and he was prepping for the mayor's call and what the managers were told, I threw out 1,000 as similar to Cary. I've thought through that a little bit further, and one of the challenges is when you add and many of you may know this, when you add a lump sum into somebody's paycheck, a lot of the value of that is gone because of the way the taxing works. And so an employee does not get $500 or $1,000, and that changes based on who the employee is. So if we want to give people a certain amount of money, we might want to consider grossing up so that people end up with the same amount, the incentive being the same for all. I've also thought a lot, and I think I was at pro rata portions, but if the incentive is to get people vaccinated, doesn't matter whether you're a full-time or a part-time employee. So just scenario-wise, if we wanted to put $500 into everybody's pocket, again, this is rough estimates, and assume all of that expense would be on our side, my estimate is that would cost us about $225,000.
Assuming no one is vaccinated.
Thank you for a clarification. Everybody gets the incentive if you're vaccinated, whether you've already done that or not.
And can prove it? Is that
yes? We would have to put in some procedures, and that's been a lot of our conversation. A cumbersome, but perhaps necessary and essential effort that primarily our human resources would do, and that's why we went ahead and had a meeting yesterday so that we could start thinking about all those things that we have to think about. There are 100 nuances to this program. I will acknowledge that. I think then what I tell you is, now that I've given you perhaps a sticker shock, it's if you give staff an authorization of an up to amount and the authority to develop a program that works for us, we can move on from this conversation, and I'm happy to answer any questions.
Okay. Councilmember Scroggins-Johnson, followed by Councilmember Fender, please.
Thank you for sharing that information. If you could answer just a couple questions, it'll help
Absolutely.
me understand. For the staff of the town of Morrisville, would that include both the full-time and the part-time staff?
Yes, we have and again, we're doing some estimates. We are going into a fall programming season, in particular for Parks and Rec, where we're adding staff. Now, one of the factors that we will put into our program is after a certain point, we won't hire you without a vaccination card. And COVID testing for employees that choose not to get vaccinated every week, that's a process we would have to implement. Yes, it could go to disciplinary. You hope it doesn't. You hope we're accomplishing the carrot. A lot of talk about carrot and stick here. But all part-time. We talked about volunteers. We would We would not incentivize volunteers, and they would have to leave the workplace if they are not vaccinated. We talked to Randy Little this morning to make sure he's got some time to work on what the potential impact on programming could be. And he's working on some data that I don't have to share so that we can continue to work through this. Hopefully our strategy would be, with guidance from you tonight, we could start getting something in place to launch out to employees next week.
Fabulous. I know that one of the concerns with individuals receiving vaccine, especially Pfizer and Moderna, is the second dosage seems to be a little bit more rigorous on the immune response, and days off is really needed for some individuals. Would you be considering, like, hypothetically, a $500 incentive and maybe days off in addition to that, so that those that are concerned about a potential response, or even if they don't have a response, then they get, a bonus day or something?
Additional time is just another laborious burden of paperwork and inequitable across our range of employees. One of the nuances that some of the municipalities have done is, you approved things like emergency sick leave and things like that, allowing that for those types of purposes and for people that are vaccinated, and not allowing that for people that are not vaccinated.
Okay, I think I understand, is that if somebody has a situation where they are unable to return to work because of side effects, if
Yes,
you will, then that would be accommodated through talking with their manager and other means. Okay. And then the final question, which none of us can answer, is there's been talk of a potential booster. And would this policy at this time just include the initial dose, so that, as we evolve through the year, there might be an option or even a mandate or recommendation to get a booster shot?
So I was very fortunate to get to talk directly to Dr. Mashunga today and ask that very specific question about that booster dose. And she said the guidance as of today is still only if you are immunocompromised should you be worrying about a third booster. The other guidance that exists right now is that third booster is about 8 months after your first shot. So, and we even talked about there are people that probably have one of two vaccines, that you have to have two in order to be incentivized, or the one if that's the shot that you got. But deferring a decision on booster shots until it's necessary. And if I may, because you've triggered me, and obviously medical and religious exemptions get handled appropriately if those are the cases.
Very good. Thank you very much.
Thank you.
Councilmember Fender, followed by Councilmember Rabati.
I have a two-part question. The first is, do Chief Andrews and Chief Griddle know the percentage of their employees that are vaccinated? And then second part is, what do they think about offering incentives? Or have they given an opinion?
So first answer is, I don't think either of them have exact counts. I think Chief Criddle would tell you that the firefighter percentage is probably at the 75 to 80% for first-line firefighters. Police, lower, probably 50% or less. Again, that's guess when we talk. The second part of your question is, we have not talked to any staff directly about incentives yet, other than the core team that got together, which was mostly HR and Jeannie. Of course, our COVID, et cetera, czar has been out of pocket. We will be pulling him back in and getting him up to speed to help us as of tomorrow.
Yeah, I'm just curious what their thoughts would be, since they're first responders and.
If I can be cheeky a little bit, incentives are money, and that will appeal to those that have not been vaccinated.
Yep.
Okay. Councilmember Rabati, please.
I think it's appalling that we've come to the place where we have to pay people to get vaccinated against a disease that can kill you. So I just want to get that out there. Having said that, what exactly are the appropriate handling measures for people with religious or medical exemptions for vaccines?
So a little bit different for both. Medical, it is statements from doctors, some proof of whatever that medical condition is. And again, that's handled in a very confidential manner through our HR department. So I wouldn't know, or anybody else wouldn't know if that was the case. And a reminder, just as we're doing tonight, all employees are wearing masks unless you are in your own work area and no one else there. So there's not a stigma to wearing a mask or not wearing a mask for any employee. And I don't think we treat each other that way in our workforce, which is a very good thing. Religious is a little bit more nuanced, and the wording that's used is a demonstrated, established religious conviction that you would request and document with HR.
So, but I guess my question is, are religious and medical exemptions being documented with HR for the purpose of getting the incentive, or are they just being documented as, I mean, if we're not going to give them the incentive, there's no sense to it.
They would not get an incentive. They would also not have to be compelled to get a vaccination.
So
and that's more if it would advance to a disciplinary situation.
no, I don't think we should compel anybody to get a vaccination that has a religious objection or a medical situation. But I just help me here. So there's a person that just doesn't want to get the vaccine because they don't trust it. Okay. There's a person that doesn't want to get the vaccine because of a religious or medical exemption. Those two things aren't the same, but those people still should be tested daily or weekly. So there's going to be a pool of people that will come forward and say, I got it, here's the proof. And they all get $500. Whatever. But then, why do we need to know whether there's a religious objection, a medical exemption, or just a distrust of whatever?
So I understand the question. I don't know that I have the best answer for you without talking to HR staff, and I'd be happy to get more clarification on that. We did talk a little bit about this. We don't have and don't expect to have a lot of medical and religious exemptions. That has not been the practice in the past, that we've seen that when other programs have been offered, that might be the case.
Although it's a difficult thing, I think that vaccinations are really important. So I think the town would benefit from making sure that as many of our employees are vaccinated as possible. Does anyone else have any more comments before we do a second round? Mayor Pro Tem?
So Martha, your ask tonight is to give you authority up to $225K to enact some kind of program to incentivize folks to get vaccinated. Is that?
So at the risk of shooting myself in the foot, just because we're working with rough numbers that we're still especially working with rec, I'd ask for up to 250 so that we can provide you more defined estimates by the end of the week. And we will ultimately have to talk about the financial thing. Do you want to do a fund balance appropriation? I am saying that and formal action I don't think is necessary in order for you to authorize to get the program started if you wanted formal action, we could bring that really for the September meeting, but I don't think we want to wait till that to get the information out to our employees, especially if we're going to start testing. September 30th seems to be the Wake County's talking September 15th. Everyone else is talking September 30th. That if you have not presented proof of vaccination by September 30, we will start implementing the weekly COVID testing. September 30th is likely. Many of the responses I got from the group I polled were, we're still working out the details, and that's kind of the boat we're in as well.
Okay. I think the only path out of what we're faced with right now is to get folks vaccinated, however we get them vaccinated. And while I'm not thrilled that we have to pay people to get vaccinated. I think if it works, it works. And at this point, I would truly like my life back. I would like to get back to normal. I'd like to get there as quick as we can. And the quickest way we're going to get there for all of us is to make sure as many people as possible are vaccinated. So,
and if I could add on to you, because the next question may be, let's offer to the community, not allowed. Can't just give it out to the community. It's not an authorized use of any money, ours or ARPA.
Okay, thank you. Well, that's, the state's already taking care of that. They're already offering, of course, it's, $100, but they're already offering incentives, financial incentives to folks to get vaccinated.
Some locations, yep. Okay, all set. Councilmember Rao, followed by Councilmember Garamella, then Councilmember Scoggins-Johnson.
It was me from a long time, so I would appreciate it.
I think you went first on this subject, so I'm making sure that Steve gets his chance.
He was on a train of thought.
Okay, fine.
The Martha, I'm having a very hard time. Why should I pay $225,000 for people like you're saying to pay everyone in spite of their vaccination?
So the premise behind that is, why penalize the people that did that proactively by only incentivizing people from a certain point in time? That's the premise behind that.
I mean to say that's not like, the federal government not going and giving $100 to everyone who got a vaccine either, right? The idea is to get to that higher target number, but I have a hard time paying people who are already vaccinated. That too, like $500, $1,000, it's kind of ridiculous to me, and this is something that should be done to protect ourselves and the people around it, and especially when you're talking about the police is only 50%. I'm having a hard time. I would not even talk to a police person close by because I don't know, like he is having or not, So that kind of a thing bothers me a lot. I'll be very upfront. And also, the other thing I have is vendors, because I was talking to my landscapers. Those guys were big no-no for vaccines. Now they work in NetApps and IBM. IBM has said all their vendors, if they're not vaccinated, they can't come onto their premise. And their mask, they usually use a kind of a hoodie thing. They said they will not even accept that. Like they're completely changing their mask guidelines of how they have to wear a mask. So because I'm worried about the Delta variant is for the kids, the volunteer soccer coaches, if they are not vaccinated, they are basically giving it to all the kids there. So that's the thing, like how can we ensure that they might be a volunteer, but they are, if he's the guy and a lot of kids got it, then it looks bad for the town that they went to the soccer or they went to the baseball and all these kids got it. So how can we ensure that is taken care of? I'd rather give them to the volunteers who are not vaccinated than the people who are already vaccinated, just give them just because thank you for what you did.
So if I could take your second part first, is we would not propose a plan where volunteers or contracted workers, so we have a lot of those that they come in and provide services, in particular in Parks and Rec. We would implement you can't do that unless you show us proof of vaccination. And that's why I mentioned we have to make sure Randy has the time to assess the impact on programs if a volunteer or a contracted worker would not provide that. We are putting something in place that says you can't provide the services to the town unless you show us this proof. We just wouldn't incentivize that.
Yeah, no, that is fine. Like the
Okay.
new vendors and everything who are coming, HVAC guy, until those are vaccinated as part of their W-2s and whatever you take, don't even have business with them. But giving the people who are vaccinated $500, it's against my ethics. I would not support that.
And I understand your perspective. It would be a disincentive to not give the same amount of incentive to everybody that is vaccinated in the workplace if that is the intended purpose. And that is repeatedly what people is the goal is to get people vaccinated, and these are my words, so we're going to do what we have to do to make that, to demonstrate that for our own workplace. I understand how you feel.
Yeah, that's mine.
And no one is proposing only for new vaccines.
You're saying no one is. And why are we given special preference where the federal is giving 100? Why we the 1,000 for us?
So I'm not recommending 1,000. I'm recommending 500 gross, which roughly costs us about $750 per person. $770, $760 when you figure out the taxes, etc. That would affect that number.
So how about we basically buy them a gift card, then?
Not allowed to buy gift cards.
No, okay. Okay. Well, that's my thing, for me. I have a hard time paying. But that's just, I'll go with whatever the council wants.
Okay. And that's why we're here, to share our ideas and our perspectives. Councilmember Rao, followed by Councilmember Scroggins-Johnson, please.
One thing I'm hearing in the public is that, in addition to vaccines and for masks, is that, with the vaccines, I think there's some people that are very confused about, well, how can I get if I'm already vaccinated, I could get the Delta variant. So, I don't want to get vaccinated because I'm safe. So I think it's important for us to educate the public or just our own staff that if you're not vaccinated, you have a greater chance of dying from the Delta variant or being hospitalized. And that's something I think that's very confusing because we're hearing so much messaging from the federal government, the state, and then just so much confusion out there. And I think that's what would make it easy for us to just, have the data and science that shows that, why we want people to be vaccinated.
So the mayor shared the Wake County PowerPoint, the recent PowerPoint presentation, and there is some very specific information about the Delta variant when you're vaccinated versus non-vaccinated. And we will continue to share that information to inform and educate our public as best we can.
Thank you, Councilmember Rao. Councilmember Scroggins-Johnson, please.
Thank you, Mayor. I just wanted to return to practical matters such as funding for this program. I understand Councilmember Garamiller's apprehension about paying money for people that have already done the right thing, right? But in the same sense, I think we need to be fair because I sense that we're going to need that booster for not just those that are immunocompromised. It's possible that the general population could need that booster as well. So what we do now is setting a precedent for what's going to happen in the future, and we want people to be healthy and safe. So paying for this program would, at this time, because you don't know about the ARPA money, it would be out of our general fund?
Yes, ma'am.
Okay. And
So
then,
we talked, I'm sorry.
go ahead.
So, talked about just some of the dynamics of how our budget works, and just a quick example. And Jeannie will tell you, we've closed our margin, and as we put other things in place to keep our positions filled. But the reality is, we approved 13 positions, and they're not filled July 1. So you automatically start developing that unexpended salary from the first day of a fiscal year. And it could be used for these types of purposes. Again, we have really narrowed our margin, and our goal is 100%, fill rate. So it's not like we have lots of money to throw out there, but it is also why I'm saying we're going to get a fund balance report, we're going to get an audit report, we're going to know what we have to work with, you're going to know the other things we're talking about using general fund. We'll have some more definitive answers on how we can use the ARPA money. We'll know how much it costs that we would be able to recommend to you the way to pay for it better.
Right. But you know today that you could use general fund until you have better clarity on the other sources, and then that could be adjusted appropriately.
Yes, ma'am.
Then the other question I have is for those that are not vaccinated, and when you do institute the policy for testing, periodic testing, whether it's weekly or whatever cycle, how is that going to be paid? Is the town paying for the testing? Is the federal government paying for testing? Is the county paying for testing? How is testing covered in this situation?
All Wake County testing is free, so we will require people to go to a Wake County testing site. And if you go out to their website, they have their normal centers and then a list of where there are testing sites that are going through the Wake County. So there should be no cost to the testing. We will pay for, since we're requiring the COVID test, they will do that on company time. So it's really part of their work hours.
Included.
Is how that would generally work. Could be an outlier type of an example, but for the most part, it would be during work hours.
Very good. Thank you.
Okay. I don't see any more comments, so I guess we can just think of raise of hands or head nods to move forward. What do you need to see from us? Just head nods?
Like hands.
Okay.
Then everybody sees everybody.
Right.
Okay. So if to give town manager and staff authorization to spend up to $250,000 to implement this vaccine program, please raise your hand at this time. Okay. So you have what you need?
I'm okay for the people to do, for like someone to just give a bonus, I'd rather give them a bonus than this. But I'm going to say, yeah, it is, but I feel very strong we should not be doing that.
Okay. So you have consensus to move forward with that program. Thank you very much for all the work that you've already done and the work that you will do to try to make all of our townspeople safe through our staff being vaccinated as possible.
And I will say, as we start, we'll be collecting data for the first time that we'll be able to sort of revalidate who's been vaccinated based on the information they provide us. It'll just give us some baselines for our employees. Morrisville is just in general low COVID incident and higher vaccination rate just as a community. I don't have specifics, but that's the information the data shows for our census tracts.
Yep. From what I can see, you've done a really good job trying to find the balance between respecting employees' privacy and trying to provide a safe environment for everyone. So thank you very much for that.
I just wanted to mention one more thing. At Cisco, we didn't get a bonus, but there was a little survey that you could go in and fill out in the HR system. to indicate that you were vaccinated, because they're only letting vaccinated people come back to the office. Like, you could still work there, but you have to work from home. So there was just a checkbox in the HR system, and if you wanted to, you could upload a copy of your vaccination report. That might be a way to, to deal with some of the paperwork.
Thank you.
Yeah, and GSK, we do like the badge readers will not be activated if those cards are not
Wow.
done. So pretty much, if they don't give it, your badge reader is.
Oh, really?
Okay.
Interesting.
What company was this?
GSK?
GSK.
GSK?
Okay.
GlaxoSmithKline.
So I believe there's a sort of second half of this COVID discussion.
Yeah, so at the end of our manager's conversation, County Manager Ellis sort of threw out, we're talking about a mask mandate, what you think? And from the start of that discussion, there was division amongst municipalities on whether they would support a mask mandate. And that's playing out. At this point in time, Apex, Fuquay Varina, Holly Springs, and Wake Forest have all indicated they would not provide, or they would not put a mask mandate in place. And this really, in some ways, relates to signing on to a Wake County amendment to the Statement of Emergency Declaration. In all 4 of those cases, they cited 2 reasons why they would not want to propose a mask mandate for the general community. That is, they think the state should be taking the lead in providing direction, and the lack of enforceability of a mandate and putting something in place that's not being enforced. So all of them were consistent in the reason why they are not providing that mandate. As you know from the news, Durham has put one in, Raleigh has put one in, Cary announced one yesterday that is going into effect tomorrow, and we have received a draft copy, Jimmy, would you mind? Of the Wake County draft declaration today. If Morrisville wanted to talk about signing on to that declaration. The only municipality that I am, I'll say 100% certain, has already committed to signing on to this is Knightdale. And I don't have full information about all the municipalities.
So we would be signing on to this declaration rather than having our own.
Well, I think that's the discussion that council is going to have.
So to clarify, Martha, both Raleigh and Cary did their own declaration. They did not sign on to Wake County.
And for consistency, it's unlikely that they would, because then they'd have to go back and rechange theirs to match this draft. So they're doing their thing separately, but I think a lot of this matches what they're doing.
So, Martha, can I ask a couple of questions? So, what kind of data do we have that relates to the town of Morrisville? I've seen the data, and I watched the Wake County Board of Commissioners meeting yesterday where Dr. Mushunga presented, and I have that presentation, and I've followed those charts. She talked a lot about, in general, for Wake County. So it would be really helpful to know what the statistics are for us. And I know she said during her presentation that she was going to try to get that information out to all the municipalities. So my assumption is there are probably several of us asking that question. And I say all that because I've also, and I don't believe she said this, I believe I read this, that, and that's why information is really important and data is really important, that of all of the COVID cases that are occurring right now in Wake County, half of them are in the city of Raleigh. I don't know where in Raleigh, but they're in Raleigh. So it would be really helpful to know where the other 50% are. And if you look at some of the maps that she presented in her presentation yesterday, it looks like a lot of it is out over in the eastern part of the county. So anyhow, what information do we have as it relates to the town of Morrisville and, over on this side of the county?
So I'll and I'm sorry, I didn't totally know what to be prepared for, so I may have to pass some things around. So this is the information that Dr. Mashunga shared with me today, because I've asked this specific question, and it is a refrain that the managers are, what are our statistics? So how does this mean to us? And so she provided me two pages. One is a case rates for census tracts. So even that is not fully defined as just Morrisville. And then a vaccination coverage by census tract. And I mentioned this a little bit. She went, oh, you're pretty good on vaccination. That was sort of her response to me. And our infection rate of COVID is at that lower end. Is that data? No, I don't have that data. It's colored maps, so I can show you that. The other one that we have from the August 16th presentation to the Wake County Board of Commissioners, this is a picture of Wake County. The darker the color, the more incident of COVID spread. We are definitely in the lighter color. And I'm happy to just allow you to look at these. I'm sorry I don't have copies for everybody.
Okay.
But data, I don't have more data than that.
Have more follow-up at this point, or should I have some other questions?
Well, that's all I have right now.
Okay.
I think that information would be really helpful to in this conversation, quite frankly.
And I do agree that I think Dr. Mashunga is trying to provide more information.
I know
or the staff. I just don't have any more than that for this conversation tonight.
Councilmember Scoggins-Johnson, followed by Councilmember Rabati, please.
The data is very helpful to me as well. That was one of my questions, but I do have another question. We received several emails, both in support of a mask mandate and some that asked for an exception. And one of the emails that we received was about games or formal events, such as events occurring at the Wake Competition Center. And one thing I did read in the Wake County draft was that there are exceptions to wearing masks, such as item number 6, giving a speech, performance, or broadcast to an audience where they maintain a distance of at least 10 feet from the audience. And as we think about the Wake Competition Center, although it says you have to wear a mask if you're in a gym or a fitness center, could it be interpreted that a formal game is actually a performance where there's an audience, and that audience, and Ann's going to weigh in just a minute, but I just, the language is a little, could be interpreted in a certain way. And the other masks are not required with swimming, obviously, because a lot of our masks are of some sort of fabric or fiber that would impede its performance. So I just needed some interpretation on that.
And I'll go first. The mayor's had several mayor's conversations that I haven't participated in. If it would be helpful to council, I can go over the emails we've received. We've received 5, so it was manageable. 2 were just supporting a mask mandate and related to healthcare industry or young children not being vaccinated. 1 was really just is an announcement coming. We had one from a restaurant in Morrisville that just says, say something so that we can be clear. And then, yes, the last one was Mr. Ammons, who is really talking about people are in, I'll call it physical activities versus
not the formal games. Okay.
If you remember way back when, this was one of the real issues when the first declaration was being put together. All of the exceptions people wanted for different things, and this was one of them. People in physical activities, etc. I would not read this Wake County Declaration as providing that exception. I don't know. I think they want an answer if Morrisville is going to sign on to this fairly quickly, and by that I mean tomorrow. So I don't know if there's opportunity to ask for adjustments or interpretations or revisions. I don't have that information. Happy to ask. I don't know if the mayor has any information.
So my understanding is that always happy to hear revisions, but given the timeline, there wouldn't be a whole lot of back and forth. So it'd probably be more of an interpretation later rather than a revision to this actual document. But I think that they're always looking to make things better. So that would be, I think that would be handled.
And if I could just add, we would get inundated with gyms and fitness facilities. They were actually some of the most vocal the first time around about looking for those exceptions during physical activity. So it wouldn't just be Wake Competition Center. That would affect
Right, and I wasn't talking about practice. I was talking about a formal game, you know, where there's an audience. That's how I was looking at that item, is like, you know, that kind of venue.
Anything else, Councilmember Scroggins-Johnson?
Nope.
Okay, Councilmember Rabadi, please.
Just under where Councilmember Scroggins-Johnson was referring to, item 2D that provides an exception for worship, religious and spiritual gatherings, funeral ceremonies, and wedding ceremonies are exempt from the requirements of Section 2. I mean, I feel about that pretty much the way that I feel about the spectators at a sporting event, which is those events are super spreaders. I mean, if we're serious about this, I think we need to strike out Section D and not sign on to the Wake County one, but do our own ordinance without that section. I mean, that's like one wedding could basically like infect the whole town.
That would be one thing to address. We could do an addendum to it, saying that that exception is not an exception, if we chose to do that.
I mean, I'd be interested in what everybody else thinks. Does anybody think that's a good idea?
I would generally like to stay with Wake County. There are the health experts, and although some religious ceremonies have been super spreaders in the past, hopefully people have learned, and that people are generally going to be responsible and not have that happen this time around. But I'd love to hear from other people too. So would anyone like to speak on that one in particular?
So I'll jump
Mayor
in
Pro
there.
Tem?
I think this whole issue that we're dealing with right here, right now, is very uncomfortable for me. There are different towns that have different proclamations and different exemptions for mass. Then you've got, because that would be Raleigh and Cary, then you got Wake County doing their thing. I think this is going to be so confusing. And as much as I would suggest that we have our own here in the town of Morrisville, based on our own numbers and our own criteria and how we as a community are doing, I think that it's just making it more confusing. I think Martha made a comment earlier about how when I think you said when the managers all talked, you talked about how it would be enforcement's going to be an issue and that statewide would be a better solution. I think the less confusing we can make this for the public, the better. I'm not sure we're going to accomplish that, quite frankly, and that's where my angst comes into play. And to the comment about, you know, people are smart enough to know whether they're going to a super spreader event or not, and they'll take precautions accordingly or not. I would tell you that goes to this whole thing we're talking about. I think there are people out there that know now. that masks help, and that I wear a mask all the time now. I go to the grocery store and I wear a mask and I don't have to. And I'm going to say something, and I don't mean this. Take this with all due respect, and I don't mean this. I know it's not going to come out right, so I'm just going to blurt it. But we have a mask mandate here in the town facilities. We are supposed to all be wearing masks in town facilities. Within the first hour of us meeting here tonight, the majority of this council did not adhere to that. So that makes me really uncomfortable to be a part of a group that's going to mandate to the public that they have to wear masks when we can't adhere to it ourselves right here and right now. And I take that with all the respect. And I say that because the public's watching. And Martha talked about a couple of people that emailed us. I've received emails and phone calls from folks on the other side saying, if you're going to do this, we really want to know why you're doing it. And we really want to have the data associated with why you're doing this and the criteria about why you're doing this. I mean, I think those are all really valid questions, and they're watching tonight. And I don't know what we're saying to them.
Well, I think, though, that we have a responsibility to, like the restaurant that reached out, people are very divided on this issue in town. So
I'm sorry.
I think we have a responsibility to help businesses by saying something, one way or the other. And if we don't say yes, then we're saying no.
And I'm not saying say no. Please understand. I'm not saying say no. I'm just saying just look at what you're presenting right now to the public, that you can't even adhere to our own mask mandate here right now.
I'm presenting myself in a personal workspace protected by plexiglass. When I got up to do the things, I put my mask back on.
That's not what our town mask mandate says.
Okay, that's my bad then. Let me put that back on.
And don't get me wrong, I'm not saying we shouldn't have a mask mandate. I'm not, that's not what I'm saying. I am just providing information that I'm concerned about. I know we all are concerned, and you all have your own opinions, and that's what we're here for. I'm just expressing my angst over this issue right now. I wish it was more across the board. I wish we were all more in sync, and I mean that as a community at large, not just town, and we're not.
Yep. Thank you. And we're here to share our opinions and our perspectives. That's why we're here. Councilmember Rao, followed by Councilmember Garamella, please.
What's our objective tonight? What are we trying to do? Because I just want to know, what are we trying to provide guidance of whether we want to have a mask mandate or not, or are we going to decide?
I'd imagine this discussion is to build consensus around the idea of supporting a mask mandate in alignment with Wake County.
Okay. I think, first of all, that one of the reasons when I take my mask off, I just have a real hard time speaking with a mask, and so it's hard for me in a meeting to wear a mask, and it gets so frustrating that sometimes I wish that I could just do the meetings virtually, so that way I wouldn't be having to take my mask off when I talk to the public. So, but with that being said, I'm in favor of aligning with the Wake County, in terms of just signing on to it. I just want, I'm hearing from people that are in favor of it. I've heard from a number of people, particularly some people I see in the morning at MAFC that are seniors that are frustrated about wearing masks in the gym when they work out, and they've come to me and said, but they've all come and said, we want Morrisville to make a decision. Do you want to have masks or do you not want to have masks? And so I think as long as we can tell the public that we're signing on to this ordinance and the Wake County ordinance, and that they know that they should wear a mask. The concern I have is the enforcement. And is it better just to have our own mask mandate? Because I think there's just so much confusion, because if you have a county and then you have a town, I mean, I just don't understand why the governor can't just say it's statewide. We're having all these ordinances, county and city, and everyone's getting confused. So whatever you all think is the best, I mean,
Well, that's the idea of the county umbrella, and in the past, all 12 signed on, so that was like the state doing it for the county. If the state did it for all of us, that would be great. If the county did it for all of us, that would be great. If we did it for all the restaurants and the businesses to give them cover and understanding. So it's a matter of levels, and the governor is not at this time willing to do it. Wake County is, so it's a matter of whether or not we want to be part of that umbrella.
so you're in favor of just signing on to the ordinance as the other mayors have done?
I was looking to hear from everybody, but yes, I'm in favor.
Why would Cary I'm just curious why Cary would do their own and not sign on to Wake County? Why would they do that?
It's my understanding they didn't want to wait till Friday. We got a copy of his declaration, and it was all about the urgency and how he's had conversations with hospital administration and how they really need their people's help now. They need decisions to be made as quickly as possible, and he felt that Wake County, because of 12 and trying to get all 12 on board, is taking a little longer. And it took a little longer last time too, but it was being done in advance of Durham and Orange and other places, so there was time to have those discussions without pressure from outside forces. This has been a unique situation in that some other counties have gotten ahead of us. So that's why it's a little fractured, frankly. And so we're trying to come together around what our health experts, we pay our taxes to get this information from Ms. Mishungo, Dr. Mishungo. And they're telling us that this is an important thing to do at this time. But it has become somewhat political, and people are trying to make sure that everything's done in the right way. So that's why we're having this discussion tonight. So,
yeah, and the last thing I'll say is it's become political because the argument against it, and I've debated this with members of the public and even some family members, is, well, why do I want to wear a mask? Because I have my individual freedom. And my comeback to that is, I don't want to wear a seatbelt when I drive in my car. I don't want to get my car inspected, but the law requires me to do it because it keeps people safe. I'm not allowed to go on an airplane with a gun or a weapon when I go through security because it's a threat. And so the COVID disease is a weapon inside of us that can infect or kill somebody. And that's where, I'm just saying that for the public watching. That's why I think it's important. So if you're out there, there are people out there who say, well, I don't want to wear a mask, you're taking away my freedom. I just don't understand. But there's a lot of things we do in this country that we don't want to do, but the law requires us to do. I don't want to drive without a license. I left my license at home. Well, you can't drive on the road without a license. You get pulled over with driving a license, you get pulled over with a license. So.
okay. Thank you. So we have two more people to hear from the first time, and then we'll circle it back again. Councilmember Garamella, followed by Councilmember Fender, please.
No, I think, Liz, you bring a good point, and for me, I took medication and then it basically nauseates me, and either I can leave or basically continue. That's pretty much my state, and that's the reason I'm having a hard time not able to wear a mask. But coming to this, I support going with the Wake County stuff because we're pretty much in a donut area because we're surrounded by RTP, we're surrounded by Durham, which already has it. RTP will come under Wake County unincorporated. Cary has already done it. So for us, being in the donut doesn't make sense. If we were the only one doing and Cary was not doing it, then for me it is okay. We may be losing businesses to that. And then I totally understand why NC, Raleigh did it and Cary did it. The article came last week, a couple of days ago. NC State opened up, only 50% of NC State is vaccinated. And that's a big problem for them. So Raleigh had to quickly do it. They have huge universities to do it. Cary, last Wednesday I was in the ER, with my pain, and it was full. I had to literally wait 2 hours outside to even get someone to do it. And so obviously their hospitals and everything are doing. So makes total sense for me. I think it always comes back to, these are just resolutions with no enforcement, and that has happened in the past too. I don't know, like, how many cases, Martha, did we get in the past, like, where we had this mask mandate and people really complain, like, I was surprised. I went last week to Walmart, and a person in front of me, I didn't wear a mask, and then she said, hey, can you wear a mask? And she gave me a mask getting into Walmart. My son yesterday went to Quick Trip to get a drink. They basically said, go get a mask and then come inside. So many of the stores are already mandating it, like, kind of, not mandating, I would say, like, encouraging it and enforcing it at the door itself. And we have a very high rate, and I don't think enforcement will be a big issue, or people will come and say, because Martha is correct, and we don't have enforcement in the right way. So it's more as more than enforcement, it's doing the right thing. And pretty much if they get a call, we don't have any enforcement. That's pretty much what we are signing off to along with it. It's not just like, we are mandating with no enforcement, is what I see it.
And if I may, that's the discussion we did have at the staff level, in particular police, because they will be, if a mandate's in place, people expect enforcement. And we were successful with education efforts, but if there's complaints, people expect something's going to be done. So when you're talking about giving clear messages, that's not a clear message. Is we're putting something in place, but we won't enforce it. And you've mentioned Walmart. There are other stores in Morrisville that, without a state directive, and they're in multiple locations, they may choose not to enforce it in their store, and that would be something that staff could be charged with having to navigate.
Anything else, Councilmember Garamilla?
That's it.
Okay. Councilmember Fender, please.
I'm in favor of signing on to the Wake County's ordinance. To Councilmember Garamilla's point, we're surrounded by Durham County and Cary. And so I think it makes sense. I don't know what the issue is with Apex and Holly Springs and Fuquay, why they are lagging behind. But just in the past week, I've read about a 16-year-old that died of COVID and a 17-year-old that's died of COVID recently. And our kids are getting ready to go back to school. My son is already back in school, and there's a lot of parents that are concerned and worried out there. I don't particularly like wearing this mask. I was, all excited not having to wear the mask, being vaccinated myself, but this is the reason why we find ourselves here. So I think we need to do something, take a stand.
Okay. Thank you. We're going to have a second round now as everyone's weighed in. Councilmember Scroggins-Johnson, anyone who wishes.
So I'm a little disappointed that we didn't have a copy of the Cary Declaration alongside the Wake County, because there are some material differences. I just pulled it up on my computer.
I have a copy, and we could make copies very quickly if that's helpful.
Well, let me just share a few of the differences. We share so many boundaries with Cary. And so I would lean towards being more consistent with Cary, and I'm going to read a few of these differences if it makes it easier for people to comply. Unless you feel like the Wake County is better there's some things that are added and there's some things that are taken out, right? So Wake County is very restrictive, saying a mask is required with any child that is 2 years or older. versus Carrie is under 5 years of age. So Carrie's a little more lenient, does not have the 2 years or under kind of, or 2 years or older mandate. Carrie wants the audience to be 20 feet from whatever activity versus 10 feet in Wake County. Wake County added swimming doesn't require a mask. It's not specified in Cary. I'm not sure if I saw the worship, religious, and spiritual gatherings. It is in there.
Yes, they have it in there too.
Okay, very good. Again, I just did this really quick. But it's just, it'd be nice to know the differences so that we can make a decision about whether we wanted to be consistent with our neighbors to help our Western Wake residents and businesses, or if we wanted to go with Wake County. And there's a good case to go with Wake County because of consistency across the county, but there would be some confusion about some of these differences.
Yeah, that's a very valid point. When I spoke to Chair Calabria a couple of days ago, I did mention to take a look at Cary and Raleigh. So they did intentionally look at what those two municipalities also did. And they, I guess, with the health experts, they made their determination of what was best. So I would venture to say that if Cary hadn't already done it, they'd be okay with Wakes, and it's different just for a couple of different reasons, and they're basing it on the information they had at hand. I would say that I would put more trust in Wake County's assessment of what's best from a health perspective, as they have a health department. So not to say anything bad about what Cary's done, which is great, and taking the lead is important, but that would be where I'd stay with Wake instead of doing the Cary, although being right next to Cary, I do understand your perspective.
Well, I don't completely think that one is more right than the other. I think that we need to think about compliance and, are the differences material enough to cause that confusion? Because just along this Town Hall Drive that we're sitting at now, there's a section that is Cary, and there's a section that is Morrisville. And technically, as you drive along, you have to mask up if you're, 3 years old versus if you're, in Wake County in general. So it's just, that's really my point. It's not somebody's smarter or better than the other. It's just what is best for the community here in this region.
Okay. Councilmember Rabati, followed by Councilmember Garamella, and then Mayor Pro Tem.
I think that Councilmember Scroggins-Johnson has a great point. I'm just thinking of that stretch of Davis Drive where Wegmans is in Cary and then Grace Park is in Morrisville, but then I'm pretty sure businesses down that way, Cary, Morrisville. So I think that the only thing that concerns me in the Cary policy is the under 5 years of age. I don't, some of those 5-year-olds are going to be in school, and that concerns me. That concerns me. That's all I have to say. That's the only thing where I would say that I would be more comfortable with. I mean, since they both have the weddings and funerals thing in there, I'd be more comfortable with the Wake County thing only because I think it's closer to CDC guidelines. So that's, that would be my opinion.
Okay. Councilmember Garamella, followed by Mayor Pro Tem.
I think instead of going more details, we can cherry pick it as to have some kind of a mandate. That's all we're looking at. We know there's no enforcement. No one is going behind a kid who is 2 years or 5 years saying you should be wearing a mask or you're not. You're 10 feet or 20 feet. I think nothing of that, even if the police is called, nothing is going to happen other than education. It is a symbolic and an awareness and education by doing these things, because I really don't think police will be enforcing any of these. Okay. So as quickly as we can, let's sign up, and next topic that we can go to.
Okay. Mayor Pro Tem Johnson.
So you just made me rethink what I was just going to say, Satish, because I talked to both TJ and Martha know that this afternoon I said I would lean more toward aligning with Cary because our borders are so intertwined, and half the time people think Wegmans in Morrisville when it's really in Cary, and so it would make more sense to align with them and what their exemptions are. But you make a really good point. If nobody's going to enforce anything, then I guess.
So why does it matter?
Yeah,
So let me ask you something about that, Martha, about enforcement. Last year when we went through this, when, of course, it was statewide mask mandate that went into effect last summer. How much was our police department pulled into enforcement and people calling and asking for help? Was it, and you don't have to give numbers, was it overwhelming? Give us some feel for how that went last summer.
I don't know that it was overwhelming. I would say that it was heavier at the front end, and of course the police, if a call comes in, the police has to respond, but they were successful at focusing on the education. So, but it is time, it is effort. It would need to be complicated or complemented with our messaging. So there is that awareness. But if a call comes, they have to respond to it, and so the messaging, and that's in the Wake County. That is not in the Cary, and that concerns me about the Cary one, putting some enforcement compliance responsibility on, that would concern me. I know from Chief Andrews, she's got concerns about enforcement. Always would. The same conversation when this came around the last time.
They have a whole paragraph related to that. You're right about that.
But they were successful at doing that. And again, we have a community that I'll say was supportive and compliant with the requests that were being made.
Okay. Councilmember Rabati, did you want to weigh in again?
Oh, no, I'm sorry.
Okay. So what I think I'm hearing is that we do have consensus that masks matter and that we'd like to align with the Wake County mask mandate. So we can go ahead and give that direction to town manager to let the county know that fact. Unless you have some new information you're getting off right now.
Chief Andrews indicate they enforced trespassing calls if that was what the call was. So if a business or something was enforcing and somebody did not comply, that was a trespassing call to them. I'm just looking to see if she's saying anything else. So we do have an integrated 911 system, 911 system, she said. So that's another nuance, but irrespective of the Cary resolution, I don't know what the workload will be on that ability to enforce as well. So it still really is education and awareness.
Yeah, so the big picture is you go out the door, you're going into a building other than your home, you're going to be wearing a mask. And it's not about the little fine details and how we're different by a few feet or by a couple of years. It's how important it is to wear a mask to try to protect the entire community. And we're hoping as more people get vaccinated, this will become moot because vaccination is the most important thing. And this is the second most important thing, but is very vital. It's like the 3 W's. You can't just do 2 of them. You have to do all 3. So vaccination is really key. We're going to keep on trying to make that happen for as many people who are willing. And then also this mask mandate will hopefully reduce this Delta variant spread. So thank you very much. This is a really good discussion tonight. I think our residents and our businesses appreciate the thoughtful nature of this discussion and how we're trying to protect everyone's health and safety. So you'll let the county know that we are signing on to the Wake County.
And did I miss a head nod or consensus?
Yeah,
or raising of hands? I'm sorry.
Yeah, we
didn't-
did that while you were communicating with Chief Andrews, so I apologize. But yes, we have consensus to move forward with the Wake County mask mandate.
We didn't do a head nod or a hand wave.
I counted all the,
No, we didn't do a head nod or a hand wave.
okay, if
That's
you're in
how we
favor of
do
aligning
that.
with the Wake County mask mandate, please raise your hand at this time.
Thank you. I think it's
Sure.
important that we do these with our hands.
I appreciate the consensus that this council came to, so thank you all very much. Thank you, Mayor. Councilmember Page. At this time, we have a roundtable. Are we interested, or we would like to postpone that for some other time?
Some other time.
I don't have like a round table, I just have a question about schedules.
Sure.
Okay. Town Manager Page, I was putting together a schedule for the next couple months. Just, because I was looking ahead. And there are some pretty exciting things going on Saturdays for our town. Specifically, like October 2nd, we have the Smart Shuttle launching. We've got Fire Safety Day. We've got quite a lot of fun things happening in the next couple months. And I was aware that you are actively planning a police academy for the council, and that is 3 consecutive weeks, one of which falls on October 2nd. And I was wondering if there's any flexibility, or, I was just trying to see if we really did have to have them all 3 consecutive weeks, or if there's any adjustments that could be made, perhaps.
I looked at scheduling with Chief Andrews, who worked with her staff. We split it up into 3 weekends. I will acknowledge, I think that was hers and mine in working with the staff proposal. We didn't think that you would appreciate an all-day. So in light of the fact that there are other activities, and when we talked about this initially, we knew that some of you would be in a campaigning period of time. And we also tried to stay away from the back end of October for those purposes. I am happy to talk with her if you want to give me some additional guidance on how you might structure it. I'll just say this is there's content in each of those. It doesn't necessarily build on each other as well. You might miss some content if there's conflicts in one day. Just an add-on. We could try to recombine it. Give me some additional guidance.
Were there any
Right.
particular weekends were problematic?
Well, October 2nd had several events. So maybe instead of a morning, it could be an afternoon or something like that, because we have, several things going on, and I just didn't want to miss Fire Safety Day, because that's a public safety event, and I'm very much in support of all things public safety, just saying.
Yeah, we serve together. I get it.
So Martha, can I just jump?
Sure.
So Martha, the one thing that's on the calendar for the 2nd is the Smart Shuttle start.
Okay.
Can we somehow incorporate that in the morning activities with us, or because I think that we all wanted to be a part of that too.
So the Smart City launch would be a very quick thing at 8 o'clock that we could move back a little bit. It would just be the Smart Shuttle launch is staged there. I think that we've talked about council could take a ride, so we could move that one back. We were trying to keep your afternoons free, but that would be a modification that would probably be simple for the police department. I know that Chief Andrews texted me late this afternoon that they had sort of confirmed the days or scheduled the rooms, but a time difference of an hour or so, if that's what you're asking about, I do not think that would be an issue for her.
Okay, because I'll tell you right now, I put these dates on my calendar. I cannot do the afternoon specifically on the 2nd. I have to
Leave right at noon.
So, But anyhow,
And I can't recall when Fire Safety Day is, I'm sorry.
I don't have that on the 2nd, so,
I thought I'd put together every
Fire
calendar.
Open House and September 11th Memorial.
yeah, I thought there,
There was on the events, the town website, there was Fire Safety Day. At least there was 2 days ago.
Feels like something you might have dreamed up.
I have the fire department open house is on September 11th.
You're so funny.
So perhaps we can have staff take a real deep dive into the schedule of the
Fire Safety Day, look.
police, and then see where the conflicts are, and maybe come back with some ideas of how we don't miss things.
Okay, so,
Counsel-
I'm sorry, where are we? Because are we
10 a.m.
keeping,
is Fire Safety Day.
I'm sorry, say again?
10 a.m. is Fire Safety Day.
No,
And
she's right. I thought she made it up, but
That's
there it
usually
is.
till 2, right?
She's not making it up.
That's usually till 2, so we'd still get the last 2 hours of that one.
Is that for the
Oh, what
youth
time is it? That's a good point.
Fire
10 a.m.
Safety Day?
To 2.
Oh,
I'll have to check on that.
Yeah.
Yeah, so that's for the youth.
Would it be okay for staff to take a look at that and send us an email and see
How it works?
to where we're at, and if they move that one by an hour on the 2nd? It'd be a choice of missing the last hour of a 4-hour class or missing the smart shuttle. So one or the other. So we can make our choices.
Shuttle to the police station.
I'm sorry?
Smart shuttle's pretty important.
Yep, I understand.
Let's take
So
the
we
smart
keep-
shuttle
we-
to the police station.
You
How about
can
that?
give the smart shuttle driver the
I'd do
first
that.
ticket. You can go behind your escort.
Give you a special ride on Friday.
Yeah,
the day
exactly.
before.
Hold on.
But I appreciate you bringing this forward, Councilmember Scroggins Johnson, because I do enjoy all the events and I do enjoy our trainings as well. So it'd be
Well,
nice
it's
to be able to
just
do both.
Because there was more than one event that I felt it was important that I raised this challenge.
Waiting for Chief Andrews.
Yep.
Okay.
I appreciate it. Thank you. I do not have any roundtable. I just wanted to kind of share.
Okay. Does anyone have any really quick roundtable item that they'd like to just mention for the benefit of everybody?
I don't think.
Sustainability thing is a really good one, too.
You got
Okay.
4 minutes if you got it.
Yes, that's it.
Okay, not seeing any of that. We're
Andrew suggests postponing.
Postponing?
the entire,
I think you've made her angry.
I'm sorry, what?
I think you've made her angry.
Oh. Well, if she can train us on the smart shuttle as we're going around town, I think that's a win-win.
so staff will dig into that a little bit and follow up with all of us on that. So we do appreciate all the effort that's already gone in to try to plan that for us, and for all the events that are going to be going on in the town. There's lots of great things going on this fall.
Work has been done. I
Yeah.
do have to acknowledge that.
Yep. So we're looking forward to that, and we thank you. And we'll do what we can to work together to try to make sure that we can all enjoy all the different activities that are being presented. Do you have anything else for the good of the order?
I do. There is a wet down ceremony on Saturday. Only 2 of you have confirmed.
Oh,
Who is planning on attending?
This Saturday?
Yes.
What time?
I thought that was like a given. I was.
did not reply? Now I
What time? 10 a.m.
We get to soak with it?
And it's not at Fire Station 1. It is at Fire
Fire Station
Station
2.
2. That's important to know because everything's
10
usually.
a.m. I think a program, and then there'll be a little bit of break for the senior center open house that begins at noon.
Mhm.
That's noon till 2.
Correct.
You also received an email from Jerry Allen on that one, and it was in the news and notes. But an RSVP was asked for the wet down ceremony. So did I see everybody's hands for 10 a.m.
Wet down, everybody coming to that?
Saturday?
Oh my gosh,
Let me
that's so
just
much
put that
fun.
on my calendar.
Let them know.
What do they do in there?
Pardon me?
What do they do in Wet Town?
It's a ceremonial thing to sort of baptize a new truck.
So it's not a champagne bottle on the bow of a ship.
Saturday slamming.
Who breaks the bottle of champagne?
No champagne.
The fire hose.
Okay.
Okay, and Jeannie says she has one, and I'd like to just talk to council after we adjourn together for 1 minute as a group as well.
Okay. I would entertain a motion to adjourn at this time.
I have one more thing.
All right.
I want to check in with you on, just before your meeting on August 24th, we're trying to coordinate with Helen Yamamoto, our librarian here at the Morrisville Library. We've had some old donated books that were from a past initiative to really raise awareness about the library. This has been hitting it. And I'm trying to coordinate with her on that day around 5 or 5:15 for a photo op opportunity to really pass over these books that they can use in their fundraising efforts for the library to buy new books. And we want to use the photo op to really showcase the library and get people to come out and get a card and join the library and use the facilities that they have.
Is that at the library or here?
We'll be at the library, and Helen suggests that we do our picture taking on the plaza, take the opportunity with the artwork that's there, and we'll make sure that we pass off the books. We've worked, our fire department group has actually helped, and they clean them up, inventory them, and they're ready to go.
Okay.
So
Yeah.
I'm going to send an email, or Will's going to send an email tomorrow. If you can be there, that would be wonderful. She would certainly appreciate it. And we're going to try to invite some former council member that was a part of this initiative previously. It may or may not, but they may or may not work for her. Depending on her schedule. We're going to try.
Thank you, Jeannie.
That is
Did
very
you say
exciting.
5 o'clock? Or did I just put it?
5:15 works with Helen.
Okay.
Ms. Yamamoto. We're trying to swap that.
What day?
Before the 24th meeting, so our next meeting, next week, next Tuesday. So if you could get here early, it'd be really nice, if possible. We know that's challenging for full-time employees. So thank you for that.
Thank you for doing that, Jeannie. That's good.
Yeah. That'll be wonderful. Will that be open to the public?
It's a photo opportunity. It's just a quick exchange, just a snapshot, and hand off the books. So that's really what it is, just to
Okay.
commemorate together, why these books existed, and then to celebrate the library.
Okay, that sounds wonderful. Anything else for the good of the order, Town Manager? Nope, all set. I'd entertain a motion to adjourn.
Move.
From Councilmember Garamella, was that a second from Councilmember Rao?
Second.
And a second. All those in favor of adjourning, please say aye.
Aye.
Any opposed? Hearing none, that carries unanimously. 7-0. It is 9:01. Thank you all. Good meeting tonight.